This is adduction. So adductor magnus. This is a muscle which helps to do adduction. Okay. So this has three fibers: upper fiber, middle fiber, and lower fiber. Upper fiber originates from ischial ramus and it is connected to the gluteal tuberosity. Middle fiber is originating from the ischial tuberosity and it is connected to the linea aspera. Linea means straight and aspera means surface. And the third, lower fiber, it originates from the pubic ramus and it is attached to the upper margin of medial condyle. This is a medial condyle and it is in the upper margin. So this adductor magnus helps for the adduction. Next we will go to gluteus medius and gluteus minimus. These are the muscle which helps to do abduction. And this gluteus medius, it originates from this iliac crest or fossa and it is attached to the greater trochanter. And this gluteus minimus just comes below this gluteus medius and also attached to the greater trochanter. And these muscle groups are activated by the nerve known as superior gluteal nerve. So this the name superior came because I will explain the inferior later. So the superior means it starts from L4. So it starts from L4, L5 and S1. Next we will go to the gluteus maximus. It is a very big muscle which helps for hip extension and to generate force. It gives the force to uplift this position. This SI joint gives the force from SI joint to the vertebra. Yes. So this
upper back, you can say.
Upper back.
Force is sent onto the upper back to keep you upright under load.
Yes. And it also helps for the stabilization of the SI joint along with the PS posterior sacroiliac ligament. So it also has three fibers: upper fiber, middle fiber and lower fiber. Upper fiber it originates from this iliac crest and it some portion it touches to the AIIS, that is anterior inferior iliac spine, and it's connected to the gluteal tuberosity. And the middle fiber it originates from the sacrum and it is also connected to the gluteal tuberosity. The lower fiber is originated from the coccyx and it is also connected to the gluteal tuberosity. The nerve which activates these muscles is known as inferior gluteal nerve. So before I told superior and now inferior. The difference is superior gluteal nerve starts from L4 and the inferior gluteal nerve starts from L5. So it originates from L5, S1 and S2. So this when we are doing squat, normally in gym they say to do 90 degree only while doing the squat because they consider it as a quadriceps activating exercise, but actually we have to activate this gluteus maximus. We have to go beyond 110 degree, then only the activation occurs. And also if we do only this 90 degree, 100 degree, our ACL may get, means the tension is more and the ACL may get damaged also. So it's recommended to do 120 degree squat. The name of calf muscle is triceps surae. By the name itself we can understand tri means three, ceps means head. So this muscle is having three heads and two muscles. That's very important. And the muscle names are soleus and gastrocnemius. This gastrocnemius muscle have two heads, lateral head and medial head. So this soleus muscle is coming from this fibula head and it is attached to the calcaneus bone. All these three muscles are attached to the calcaneus bone and through the tendon Achilles tendon. So if any injury occurs to this Achilles tendon, doctors will refer the name as Achilles tendon rupture. It has grade 1, grade 2 and grade 3, and if severe injury occurs to this tendon, it is very difficult to recover from that. So, and as I told, this gastrocnemius muscle have two heads, lateral and medial. The lateral head originates from the lateral condyle posteriorly, and also it connects to the it attached to the calcaneus bone. And this medial head originates from the medial condyle posteriorly, and same it connects to the calcaneus bone. And very important about the nerve, this sural nerve. We already know about the sciatica nerve, which gets split as peroneal nerve, and it comes down as tibial nerve, and from there lots of small nerves, and these nerves are known as sural nerve. And the joint of action of these muscles is plantar flexion. So examples are calf raise, seated calf raise, standing calf raise. Even in squat, this plantar flexion is happening. So if someone says that this calf raise, seated calf raise is for focusing more on soleus, and standing calf raise is focusing more on this gastrocnemius, they are wrong. Actually, for plantar flexion, both these muscles are focused. So let's go to the other muscle, next muscle, tibialis anterior. So this, as the name anterior, it's from the front. So this muscle originates from the lateral tibial head, and it goes below the feet up to the toe medially. And for activating this muscle, the joint of action